Hi, my name is Brenda Farmer. I am a student here at ULR this spring, and I wanted to tell you guys about my service learning project that I dedicated 4 hours to. This service learning project that I was a part of was at the 12th Street Health and Wellness Center here in Little Rock, Arkansas. This clinic is community based. It's student led with interpersonal health and wellness center that provides free health screenings and health management services for people of the community. They currently do not provide any COVID screenings, so if you are having any symptoms, they advise you not to visit their center, to actually seek help elsewhere. The address is 4010 West 12th Street here in Little Rock, Arkansas. The building is located on the corner of 12th and Cedar Street. No appointment is currently necessary, but they do ask that you call to schedule an appointment to kind of help offset some of the heavy loads from their walk ins. The best way to schedule an appointment is by phone number at 501 614 2492. Again, that is 501 614 2492. My duties during Women's Health Night were to check people in for their appointments and gather necessary paperwork for the student professionals on duty. My duties helped the night run smoothly and people were able to be seen in a timely fashion. The hours of operation were from 4 to 9 p.m., and this is mostly geared towards people who work during the daytime so they are able to actually be seen. Many people all over the globe, they are in dire need of healthcare services and they are unable to financially pay for them. So, this service learning project meets the needs of the social determinants of health by providing healthcare access and quality. The goal of this is to increase access to comprehensive, high quality healthcare services. This was met by no one having to pay for their services that were provided that night. No payment was asked for before service or even after services were geared. All of the services provided that night were free of charge and it helped the students learn in a clinical environment. Anyone who needed any further help were evaluated and scheduled for follow ups with UAMS. The community resources that met the needs of the social determinant of health were on site pap smears, IUD placements for birth control, physical screenings, and they even provided blood work on site. Although the screenings were led by medical students, physicians were on hand to supervise and provide guidance to these students. There were also translator devices that were used to help with communication barriers for people who had issues with speaking English fluently. It helped people who had Hispanic backgrounds that night. Um, the impact that I felt I made with this service learning project was that I was able to give back to the community that I actually grew up in. I remember the clinic was once a pharmacy store where when I was younger, I used to go there with my grandparents and get their medicines with them. It was very surreal to me to actually see that this building was being used to help people in our community. I was able to help the women feel comfortable as they were being waited to be seen by the student professionals. I even gave and offered treats to the children who were waiting for their mothers to be seen. Um, to me, being able to greet them with an honest smile, it just seemed to make a world of difference in these people's lives. My biggest takeaway from this experience is acknowledging that everyone has struggles in one way or another. And it is my duty as a nurse to find ways to help people overcome these struggles and not judge a book by its cover. even if that simple thing is for me to learn a little Espanol. So, gracias por ver mi video.